Welcome back. Well, we have with us Dr. Adithya from the Mazumdar Shore Cancer Translation Research Center and also Dr. Sharath Damodar, who's a senior consultant hematologist there as well in Bangalore. Thank you both so much for being with us, as always. You know, can I just at least, there are people who are still saying, look, we still don't get completely what cancer is. And one of the things that we want to do during the day is to keep on coming back to that question so that people understand what exactly cancer is. So let me start off by asking you now, from whatever we've been able to understand during the course of the day otherwise, cancer is basically a genetic mutation that takes place, and a cell which would stop dividing constantly continues to divide. And it's a series of genetic mutations that ends up causing that.
Right.
Why does that happen? And what are the reasons for it?
Well, part of it is just chance, you know. I mean, we've got billions and trillions of cells dividing every day. And although the body does its best to keep them in check, sometimes, you know, one of those cells escape the mechanism. The other is the lifestyle you may lead, the kind of food you eat, the environment you live in. Those things are also constantly affecting how your cells evolve. So those are the two main things.
So again, to take that forward, and just to help people who don't understand this, you've got cells that are constantly replicating inside your body. And when there's the wrong mutation that takes place, then the cells start to, keep on dividing. The lesser genes which are there don't act on it. That can happen either because of chance, as was just said. It could happen because of environmental reasons or hereditary reasons.
Genetic, yeah.
Genetic reasons, essentially. Or it could happen because of things like tobacco and alcohol and obesity and what are the other factors?
The other, environmental toxins which we get exposed to. You really don't know, for pesticides in your food, to the environmental air, to radiation exposure. There are innumerable things which can come up to. It's always, more than one hit which is required to keep this going. So you need 2-3 things to come together, and then this goes out of control. Normally the body also has a mechanism to knock off this cancerous cell because it's seen as abnormal. So there is immune mechanisms to actually control it. When that mechanism is overcome, then you have a truly cancerous proliferation occurring.
So the body's immunological response also has to go. So actually you need a series of events to take place before cancer should theoretically kick in. So it's almost baffling as to why so many cancers are happening. Is it just because we are surrounded by too many carcinogens?
Carcinogens and just the number of cells, I mean, there are so many people and there are so many things happening that how much ever you try and keep this in check, there is always going to be this one cell which is going to go rogue.
One of the biggest carcinogens, which is cigarette smoke, should actually be on its way down because people aren't smoking as much as they once used to.
Right.
So theoretically that should start kicking in at some point. So I mean, what's the number? 20-25% is caused because of tobacco?
Yes, but now, in India at least we had the highest incidence being head and neck cancers, in addition to cervical cancers, and among children we've already discussed during the day about leukemia, where you really don't have any causative factor there. Just by controlling cigarette smoking per se, still hasn't brought down enough of tobacco usage per se in India, still.
So
and there are still other things. And we still don't know about environmental toxins which are now kind of part of our daily life. We don't even know. So Vikram, like you said earlier, one aspect is how come somebody is getting. The other way to look at it is how come with so much around, so many people are not getting it. In spite of kicking in.
All right, well.